All right, since 2013, the prices of 20 of the most prescribed drugs for seniors have risen on an average of 12% a year. Although Medicare's open enrollment doesn't start until October, now's the time to talk about what does and what does not get covered, so you will be aware. Money expert J.B. Bryan is here with some helpful information. All right, we got to stay focused. We were fooling around over there a little while ago. But this is an important topic, isn't it?
It really is. And as an investment advisor, often financial professionals, we overlook how much of your retirement money goes towards covering uncovered health care and medical expenses. So we need to include a plan that says, I think that my premium will be at least this amount when I retire. So it's for the people at home who are about to retire, thinking about retirement, and or already in a Medicare plan and think that they probably haven't put enough time into selecting it. So
you got two categories there. You got people looking down the road and people are already in it that say, wait a minute.
I thought it was going to cover more.
Yeah, I need to tune this up a little bit.
How do you plan for a $20,000 medical expense when you
in a panic?
That's right. That's right. And they didn't expect it.
Yeah.
That's right.
You know, it is a fact of life. You know, as we age, there are going to be problems. Some of them will be major.
Yes.
And you got to cover that.
Yes. So when you're 65, the Part A will cover things where you have to go inpatient. So that would be major medical things. You're in the hospital. That's going to be covered.
Yep.
But then you have the extra things that are considered outpatient and physician coverage. Well, then you have to have the Part B. So that will actually deduct your Social Security income in order to cover that. And the premiums could be quite high if your income is high, then the premium for your Part B will be adjusted higher. So that is money that you need to consider in your financial planning process, that I am going to have to pay for medical care, and some of the expenses will not be covered because there's deductibles, there's co-pays, even if you have A and B.
And you need some more letters in there. All right,
That's right.
I
That's right.
got some true-false questions. Traditional Medicare covers dental and vision coverage.
The traditional Part A does not cover the dental and the vision. And so many people at home assume that it covers everything because many of them have been at work and their employer plan covered everything. And then the employer said, well, when you retire, you're going to go into Medicare. So they assume, and assuming is really bad.
And you know what happens when you
That's
assume.
right. So it does not cover that.
Okay. How about drugs and prescriptions?
And your basic Medicare Part A does not cover that, your drug coverage either. So it also was an incentive for us to be as healthy as possible. But I also encourage everyone, Bill, to not depend on their financial advisor for which drug coverage to select, but to actually go to Medicare.gov and put in the drugs that you're taking and see which plan, because the Medicare.gov website, that's right, go straight there, call the toll-free number if you need additional help, get your financial advisor to help you in the selection process, but don't just focus on a product. Don't be oversold on, oh, this product says it's free. Because when you're talking about medical care and you're talking about Medicare, you get what you pay for. You really do. So if you're putting zero for the premium, generally you're going to be paying down the road.
This is a government entity, so obviously politics changes and everything. Are there changes coming up this year?
True, and there are some changes. And I didn't discuss the Advantage program. That's Medicare Plan C, and I think the word Advantage is misleading, but it's just a plan where it's a private insurer that takes over your A and B coverage, and they add on extra things. So the Advantage plans, the Medicare Part C, is actually adding on some additional things. So be on the lookout, find out if you have an Advantage plan, what is going to be covered. Some things like adult daycare are starting to be added, some home health care, some improvements that you may need for changes like railing and things in the home. So definitely check out the Advantage programs. And then most importantly, look at the difference between an Advantage program and a GAP, a Medigap program. So a Medigap will cover your deductibles and your copay, and it'll cover much more. But your Advantage programs are designed to limit your out-of-pocket, where the GAP is to cover it. Okay. So this is deep. I'm sorry, you're making me.
That's right. So we got to have A and B, and then maybe an Advantage, maybe in D and E and F or something.
And the A is what comes because you've worked for the 10 years and you qualified. Right. So you get that.
Oh, we need her. We need her here, and you do too. JB Bryan offers money seminars and webinars every Wednesday and Sunday evenings. They are absolutely free, but pre-registration is required. You'll find a link to all the details at WTVR.com/VTN.